My name is Bronte Ballin, and today I'm going to be talking about pediatric brain tumors. This is our first part of 2, and this is for the Radiology Scholars Certificate Program. The learning objectives for this lecture are to identify common pediatric brain tumors and also to recognize pilocytic astrocytomas and medulloblastomas on CT and MRI. Brain tumors are generally divided into adult brain tumors and pediatric brain tumors. We already have 2 videos about the adult brain tumors you see listed on the left, and also common presenting symptoms associated with brain tumors. So please watch those videos for more information about those topics. And today we will be talking about 2 of the 5 pediatric brain tumors we will be covering in this series. The first tumor that we will be talking about today is a pilocytic astrocytoma. These tumors are cystic with nodular appearance. They tend to be slower growing and therefore will have mild edema, making them more difficult to identify on CT imaging. Patients can also have obstructive hydrocephalus due to the mass effect on the 4th ventricle. The typical position is in the posterior fossa in children. On the right, we have an axial image from a non-contrast CT. You can see the cystic portion is hypoattenuating and the mural nodule is isoattenuating to the brain, and there's mild edema. MRI is a very useful imaging modality to identify and differentiate types of brain tumors. On the left, we have an axial T2 FLAIR image, and on the right, we have an axial post-contrast T1 image. For more information on how to differentiate types of images and how to develop an approach to reading different imaging modalities, please keep an eye out for our videos where we cover these topics. So if you look at the axial T2 FLAIR image, you can see that the cystic portion has this hypointensity, whereas the mural nodule will have this mild hyperintensity. You can also see that there is mild signal hyperintensity in the surrounding parenchyma. This is consistent with peritumor edema. And then if you look at the axial post-contrast T1 image, you can see that the cystic portion has this hypointensity with peripheral enhancement, and the mural nodule will have this solidly enhancing appearance. The mass is best delineated on that post-contrast image, as you can see. The next tumor we are talking about is a medulloblastoma. Now, a medulloblastoma can present very differently depending on the tumor grouping or the patient's condition. So today we are going to be focusing on the most classic presentation. The typical location is the posterior fossa, usually midline, and can commonly protrude into the 4th ventricle, causing obstructive hydrocephalus. On the right, we have an axial image from a non-contrast head CT, and as you can see, the mass is hyper-attenuating to the brain. It is also causing mass effect on the 4th ventricle, which is in turn causing enlargement of the 3rd ventricle and the temporal horns of the lateral ventricles. Medulloblastomas can potentially cause something called drop metastasis, which is when the tumor spreads via the CSF to involve the spinal canal or the spinal cord. This helps to differentiate the tumor from other posterior fossa tumors, such as the pilocytic astrocytoma we just spoke about, which rarely spread to the spine. Here are some MRI images of the medulloblastoma. On the left, we have an axial diffusion-weighted image, and on the right, we have an axial post-contrast T1 image. So on this diffusion-weighted image, we can see that there is hyperintense signaling throughout the lesion, indicating restricted diffusion. This is a defining imaging characteristic. Restricted diffusion is most often described with something like infarcts, but it can also be seen with other conditions, such as hypercellular tumors, like a medulloblastoma or a lymphoma. This is a very important finding as it helps physicians differentiate this tumor from other posterior fossa tumors in children, like an ependymoma or the pilocytic astrocytoma we talked about earlier. On the post-contrast T1 image, you can see heterogeneous internal enhancement. Thanks so much for watching. Here are some references that I used in researching this presentation, and if you would like to learn more about pediatric brain tumors, please watch part 2.